Welcome everyone. Today I am going to speak on the use of artificial intelligence for oocyte assessment. First things first, let us quickly look into the slide that explains where we stand today in terms of AI. So every AI tool, including ChatGPT, that is available in the market today is categorized as artificial narrow intelligence or ANI, and it is meant to perform specific tasks. AGI stands for Artificial General Intelligence, and we might reach there in decades to come. And what we often dread and fear, that is AI surpassing human intelligence and taking over the world, is called Artificial Super Intelligence or ASI, and that is not even near our horizon currently. So with this, we need to be reassured that whatever tools that we have in the market is designed to achieve just specific tasks and will not replace human embryologists. Before digging deeper into the oocyte assessment, we should do a suitability assessment of tools and ask, when should, mark my words, when should a task be automated by AI? So the question you need to ask yourself, is the AI tool going to automate a repetitive task? Is it going to reduce time taken to perform a task? Is it going to minimize the cost for performing a task? Does it have a potential to reduce human error? And is it available 365 by 24 by 7? Assessment of oocytes, which is the task in question, does seem to be a task that should be automated by AI because it is repetitive, of course, it is. It may not directly reduce the time taken to perform oocyte assessment when you use an AI tool because embryologists take fraction of seconds to assess an oocyte, but it will definitely reduce the time taken to document the finding. Initially, it may not minimize the cost for performing a task if you're just assessing a few oocytes a day. But over the years, and especially in busy labs where you have many oocytes to be assessed because of many OPUs happening in the day, it does seem to have a potential for minimizing the cost of oocyte assessment. It also has a potential for reducing human error when you have multiple cases that are handled in the lab. And of course, it has a 365 by 24 by 7 availability with no festive holidays. So yes, oocyte assessment does seem to be a task that should be automated by AI. So now the next question, what value can oocyte assessment have? So we can divide the need for oocyte assessment into two major categories, prediction and procedural accuracy. Let's take prediction first. So the most obvious benefit of oocyte assessment would be in cases of fertility preservation. We will take all of these examples in a while, and then for cases of decisions on embryo pooling, for deciding fresh versus frozen transfer, and overall as a better tool for patient counseling. Then comes the procedural accuracy, which is like the indirect impact of oocyte assessment. Let's take the oocyte pooling for fertility preservation first. Imagine retrieving 6 oocytes for fertility preservation for a case of social freezing for a 37-year-old female. Experienced embryologists will be able to tell right away that there is a high chance that these oocytes might not lead to a live birth eventually, and you might want to suggest another cycle of oocyte harvesting. Showing her a report of the oocyte score and telling her that it will be best to try one more cycle. So the power of such a tool is immense when it comes for patient counseling, and that too in a very objective fashion. This, by the way, is an actual report from a tool under development by the group Life Whisperer. That is the ability to score a cohort of oocytes and predict blastulation. The next case is embryo pooling for low ovarian reserve. This is what we are faced with every other day almost. This is a case of a 38-year-old female with poor ovarian reserve where we have retrieved just 4 oocytes, and our job is to update the clinician with fair degree of confidence if she needs an additional cycle of harvesting before trying cycles of embryo transfer. So backing up our gut feel with a decision support system that agrees with our embryology knowledge is of immense benefit. We can go ahead and provide the report to the clinician, and the patient can be counseled accordingly. The third case is when we want to decide between a fresh cycle ET or a frozen cycle ET. This is one of the most pertinent and oftentimes the most annoying questions posed by a clinician to an embryologist. Here, having a decision support tool to back up our calculated gut feel as an embryologist has huge benefit. Patient counseling is often an underrated part of an entire IVF cycle. In my opinion, I think it is the most important part that needs to be handled as objectively as possible. But unfortunately, the clinicians who are the ones facing the patient have dearth of properly documented embryology sheets to substantiate what they are saying. This lowers the confidence of patient, especially in cases of IVF failure. So this is what a report from Oocyte assessment tool looks like, where you can go through oocyte by oocyte and explain to the patient what to expect from their gametes. This product by Future Fertility, one is called Violet, this is for oocyte freezing, while Magenta is for predicting live birth and blastulation. A successful IVF cycle with a patient may generate you 2 more patients, but handling an IVF failure and counseling the patient objectively and empathetically will generate 4 more patients for sure. Now moving on to the next category of benefits of oocyte assessment would be for procedural accuracy. Experienced embryologists often delay the denudation of oocytes based on OCC morphology for late maturing oocytes by a few hours when they think that the OCCs might benefit from further culture. However, at times after denuding a cohort, you can tell if the cohort is a case of late maturing oocytes or not, and in such cases, one could wait for a few hours before fertilizing them with ICSI. Now, imagine having a tool that can go through an image of a cohort of an oocyte and give a score which indicates a lower score for oocyte that seem to be late maturing. This way, ICSI can be timed accordingly. Another use of oocyte scoring is in case of donor-recipient matching cycle, where by law you are supposed to fertilize a maximum of 7 oocytes. This tool will help you choose the most competent 7 oocytes for best result. 2 more rather indirect benefit of oocyte assessment for procedural accuracy would be measuring the clinical KPI of M2 at ICSI and the IVF Lab competency. So by measuring clinical KPI of M2 at ICSI and reporting the oocyte score after each OPU, you can indirectly indicate the quality of IVF stimulation. Getting many GVs and M1s after OPU may be at times a few one-off cases. However, if your IVF lab is consistently getting low number of mature oocytes at ICSI, then it does reflect that the IVF stimulation is not optimal. It could be either a clinician new to IVF stimulation or a batch of gonadotropin or the trigger dose batch or type. So the oocyte competency report will help to objectify the problem and present trends in KPI. Another interesting use of oocyte assessment tool is for measuring the IVF lab competency. Here, if you are consistently presented with high scoring oocytes after each OPU, and the male semen parameters in each case is optimal, and yet your IVF lab is unable to produce competency level of blastulation, then it might be a warning sign that the culture condition is not optimal and needs further scrutiny. So these are all the reasons why oocyte assessment should be considered as a part of your IVF lab workflow. Now that we are convinced that it does make sense to assess oocytes and we wish to use AI tools for automated oocyte assessment, we should know that we can only automate what we are able to perform manually with fair degree of confidence. So how accurate is the process of oocyte assessment today when done manually? So through a thorough literature search, we are presented with these highly cited manuscripts from reputed high-impact journals. The first one concludes that severe cytoplasmic deviations does impact the developmental and implantation potential of the oocyte. But this literature was from 2006. The next literature from the year 2010 mentions that none of these features were unanimously evaluated to have prognostic value for further developmental competency of the oocytes. The next, more recent systematic review that tries to identify all literature on the morphological characteristic and associate them with oocyte selection concludes that none of the morphological characteristics like vacuoles, refractile bodies, shape of oocyte, cytoplasmic granulation, viscosity, etc., that they show no consensus on which of these morphologies are best suited for oocyte selection. And lastly, the most recent systematic review on does morphological assessment predict oocyte developmental competence identifies 6 extracytoplasmic and 5 intracytoplasmic parameters as shown here and associates a oocyte literature score or OLS to oocytes based on these parameters. And as shown, most literature agree to these findings that the extracytoplasmic feature that has the highest capability to predict competence of the oocyte is the COC morphology, actually a step before oocyte assessment, which most embryologists would agree. And the next extracytoplasmic feature is the PVS, or the amount of space that you see in the PVS. While in intracytoplasmic parameters, the presence of vacuoles and cytoplasmic granularity does impact the oocyte competence. So we can conclude with fair degree of confidence that there are some morphological characteristics that do indicate the competence of oocytes. Let us quickly see what these are. So zona uniformity, thickness and birefringence, the PVS uniformity and presence or absence of debris in it, fragmentation and size of polar bodies, cytoplasmic granularity and presence of vacuoles, pitting, refractile bodies or SER. Now most of these features are easy to identify by trained eyes by simple evaluation under optical light microscopy. But for one feature, which is the birefringence of zona, you need polarized light microscopy. However, as shown in the figure, even with optical microscopy, you can identify some level of difference in the presentation of the zona defect, as shown here. The image towards the right is from a case of a patient with fragile oocytes, most probably missing a zona protein that is used for cross-linking these zona layers. Our job today is to understand if AI tools can be used to automate oocyte assessment. These are some terminologies and buzzwords like data augmentation, knowledge distillation, ensemble model, supervised learning, data cleansing, stochastic gradient descent. These are AI buzzwords that you can conveniently ignore today, because every time you make an effort to understand the AI model and are presented with these buzzwords, we end up not going any further in our reading as biologists. That's the entire reason why we took biology as our major, right? But let us try and understand some important concepts when it comes to AI model training. At first, the data that is used to train AI model is cleansed to remove mislabeled images. Simply put, we need to make sure that an image labeled as M2 oocyte is actually an M2 oocyte and not a day 3 embryo. Next step includes object detection and the application of bounding boxes to isolate and crop the relevant part of the image. This prepares the data for more accurate analysis by focusing on the significant part of the image. In this final step of image segmentation, the model identifies regions of interest or ROI within these images. Segmentation allows the model to focus on specific areas that are critical for its task, such as recognizing patterns or features within the image. This particular slide explains the concept of image segmentation. It highlights the process of dividing an image into multiple segments or regions to simplify analysis, particularly for oocyte assessment. As you see, identifying the polar body is the most difficult one, as it completely is dependent on the angle at which the oocyte presents during the image capture. For those who argue that AI models are often black box models and it is difficult to say what AI model is concentrating on, this particular slide discusses on how AI models, particularly the CNN or convolutional neural network, uses heat maps to visualize which area of an image the model focuses on while making its predictions. Heat maps are color-coded representations that highlight the regions of an image that the AI considers important for its analysis. In this slide, the yellow area on the oocyte image indicates regions where the model is currently focusing. By using heat maps, researchers can better understand the decision-making process of AI model, making the analysis more interpretable and transparent. These next slides breaks down the image processing and analysis step and shows the AI model architecture. And honestly, I included these slides just to reiterate on the fact that AI is not just fluff. Many things are happening behind the model, and AI scientists have invested a lot of energy and time in designing these models. Now coming to image capture mechanism for oocyte assessment. At the moment, these are the two systems available for image capture. You can either use a high-quality digital camera attached to an inverted microscope to capture the images and upload it to an AI tool hosted on a web-based portal for analysis. The obvious advantage of the system is that it does not need any additional equipment within your IVF lab and is pretty inexpensive. The disadvantage being increased exposure time for oocytes for capturing the image and possibility of human error due to mislabeling and traceability. The second system, as described towards the right, for image capture is integrated within the time-lapse incubator, which takes care of not introducing additional oocyte exposure for image capture, but at the same time, the major disadvantage is its cost. But I'm very hopeful that in near future, the cost will come down. These are some AI-based tools that are available in the market as of 2024 when it comes to oocyte assessment. Two companies that deal with web-based AI tools for oocyte assessment are Future Fertility with two products, Magenta and Violet, and Life Whisperer's product Oocyte Viability, which is about to be released this year if I'm not wrong. For AI tools that are integrated within time-lapse system, you have Chloe OQ by Fertility, which is available with both EmbryoScope and ESCO-MIRI time-lapse. Next, we should know when to assess the oocytes. Does it make any difference if we capture the image of the oocyte just before ICSI or just after ICSI? This study highlights the importance of timing of oocyte image capture on prediction of blastulation by AI-based oocyte assessment tools. The main result shows that post-ICSI images are more effective for predicting blastulation as compared to pre-ICSI images. The AUC or area under curve for prediction of blastulation was higher for post-ICSI images, which is 0.66, as compared to pre-ICSI images, which was about 0.57. This brings us to the accuracy of AI-based oocyte assessment. For this, please revise statistics relevant for assessment of prediction model a bit. So a brief slide on terminologies like true positive, true negative, false positive, etc. An ideal prediction model should achieve 100% true positive, 0% false positive, 100% true negative, and 0% false negative, meaning the prediction model should predict 100% of the times that the oocyte will make a blastocyst, when it actually makes one, and so on. With this, we move forward to defining receiver operator characteristics or ROC. So like we mentioned, the perfect model should have 100% true positive rate and 0% false positive rate, making the AUC or area under curve as 1.0. So the AUC is this shaded area under the ROC curve. Larger this area, the better the model performance. It is also important to note that any random model, just like a coin flip, will have AUC of 0.5. It is like predicting one result half of the time and the other the rest of the time. So any model that is not random should have higher than 0.5 AUC, and more the AUC, the better. As you can see, a good model will have AUC between 0.7 to 0.8, whereas an excellent model will have an AUC between 0.9 to 1.0. So after this revision, let us quickly see how do the oocyte assessment models fare today. This study that was performed with 7,412 images mentions the AUC of 0.66, which is just about satisfactory range. Another study that has tested a model with 37,133 static images mentions AUC of 0.64, which again is just about the satisfactory range. The third study, with just about 165 oocytes, evaluates accuracy of violet tool with a different statistical reporting system mentioned in percentages. So at this point, my 2 cents, which resonates with quote by Aaron Levinstein, is statistics is like bikinis. What they reveal is suggestive, but what they conceal is vital. Before I move to the actual demonstration, I would like to end saying that looks can be deceptive. Not all good-looking oocytes make pretty blastocysts. We all know this from our real-life examples and experiences, right? So coming to the demonstration of a tool for oocyte assessment, I had the privilege of supporting Life Whisperer team by providing testing data for one of their tools. So I had the opportunity to access the beta testing platform. So here a demonstration from it. As you can see, all you need to do is upload images of either individual oocytes or cohort of oocytes, and the tool processes the images to associate a score to the oocyte and likelihood of blastulation. To my knowledge, this is the only tool available in the market. Actually, this tool is not in the market yet, but will be there very soon. That can also assess a cohort of oocyte and associate a score to it. I personally find this use case much more beneficial than assessment of individual oocytes. Finally, to end the presentation, I would want to say that you can only teach what you know, emphasizing that AI model training is highly dependent on the data that is used to train it and who is training the model. Thank you so much for your time and your patience.